Good day, everyone. Welcome to our Rationalization for LT4, care of clients with physiologic and psychosocial alterations, Part A, or care of adult clients in pain. A client asks a nurse what is the difference between analgesia and anesthesia. The nurse explains that analgesics and anesthetics differ in that an anesthetic causes a loss of feeling and sensation, is more appropriate for pain relief, causes loss of consciousness, or requires a larger dose for pain relief. Of course, we know that anesthetic is a pharmacologic substance that, in addition to abolishing pain, generally causes loss of feeling and at the same time sedation. Answer for number one, alpha. And of course, we know that anesthetic is not most appropriate for pain relief and it should not cause loss of consciousness and it does not require any larger dose. Number one is letter A. Two, the nurse reminds a group of student nurses that the most significant problem associated with the use of demand or nurse administered analgesia is it a determination of the difference between the pain control and addition, the nurse's underestimation of the need for medication, the ability of heavily assigned nurses to respond in a timely manner, or pain medications being administered too close to one another? The answer here is letter B. The traditional method of treating pain is by nurse administered pain medication. It is unfortunate that this system pain is often significantly undertreated because nurses underestimate the client's needs for pain medication. Two, the best answer is letter B. Three, in care for a child receiving an open analgesic through an epidural catheter, the nurse's responsibility of prime importance is assisting the client with frequent position changes, establishing the baseline laboratory profile, hourly infection of the catheter's insertion site, or dressing for respiratory depression. Answer here is D. Possible effects of epidural opioids are pruritus, urinary retention, respiratory depression occurring 4 to 12 hours after a dose. So 3, the best answer is delta, specifically for respiratory depression. 4, a client is having a small wart removed from his index finger. The nurse, the nurse assisting with this procedure would question the use of procaine, lidocaine, xylocaine, or novocaine with epinephrine. Answer here is delta. Epinephrine containing solutions are not used to to, to block nerves of the penis, fingers, or toes where vasoconstriction could cause inadequate blood flow and necrosis of the distal extremity. 4. Delta. 5. The nurse practitioner infiltrates the area around a lesion to be increased with procaine. The NP should anticipate a waiting period of not significant 3 to 5 minutes, 1/4 to 1/2 hour, or optimally 1 hour. So, of course, we know that procaine produces its effect in 3 to 5 minutes and usually lasts more or less 1 hour. So, number 5, the best answer is letter B. A client who is receiving morphine, 10 milligram PRN for severe postoperative pain, should have a respiratory assessment immediately after the morphine is given, 10 minutes after the morphine is given, or 30 minutes after the client has been medicated, or continuously with an apnea monitor. Number 6, the best answer here is letter C, 30 minutes after the client has been medicated. Next, because of the need to reverse respiratory depression after administration of a narcotic analgesic, the charge nurse keeps on hand the drug aminophylline, furosemide, naloxone, or oxymorphone. Answer here is C, because there's a presence of respiratory depression, so therefore we're going to go back to the medulla oblongata. Number 7, that is letter C, naloxone or Narcan. 8. The teaching plan for an individual receiving transcutaneous ethical nerve stimulation should include the information that one electrode only is used. The electrode wires is the electrode wire should be visible to to detect early problems, where the client can adjust both voltage and pulsation. Or this therapy is useful for for very few clients. Of course, we know that voltage and pulsations are controlled by the person wearing the device. Positive and negative poles are placed with several inches of each other. Then TNS has been shown to relieve pain effectively in many people. 8 is letter C. 9. The nurse explains the factor that what would influence the amount of pain experienced by the client 2 days after the mastectomy would be anxiety over future appearance. Letter B, the child's previous experience with pain. Letter C, the child's concern about tradition. Or letter D, the child's nutritional status. The answer for number 9 is letter A, that's anxiety. And of course, we know that the degree of anxiety of the client is experiencing will also influence the response to pain. And you know that anxiety intensifies the pain experience. 9 is alpha. Then the client has had a right below the amputation 2 days ago is requesting pain medication for pain in his client. The nurse should instruct, tell the client that he cannot be medicated for pain in absent extremities, or tell elevate the stamp on pillows, offer an alternative therapy such as message or massage, or administer the prescribed analgesic. Of course, there's a process of phantom pain that does occur. There's throbbing, burning, stabbing, or boring, or a vice-like sensations are experienced in the amputated area. So, still answer delta. 11. The nurse instructs the client they can be prevented that the drug is effective for pain relief because it acts to interrupt the transmission of pain impulses, interrupt the inflammation, block prostaglandin, interfere with relief of pain information through dorsal horn, or slow painful stimuli through a type A delta pain fibers. For the site of action of NSAIDs is primarily the periphery at the insertion site, where NSAIDs served as anti-inflammatory function and uh, prevent the production of prostaglandin. The answer here is letter D. Administer the prescribed analgesic. 11. The nurse instructs the client they can prevent that the drug is effective for pain relief because it acts to answer B. Reduce inflammation and block prostaglandins. So, of course, that's what I mentioned. NSAIDs are primarily the periphery at the receptor site, where NSAIDs served as an anti-inflammatory function and, of course, prevent the production of prostaglandin. 12. 2 days after cholecystectomy, the client is kept comfortable with oral NSAIDs. The client's wife asks the nurse why her husband is not receiving something stronger, saying, I know the procedure causes a lot of pain because I also had my gallbladder removed. The nurse's answer is based on the fact that the client would be switched to pain medication as quickly as possible. The oral route is always the preferred route for medication. Strong analgesics interfere with client when the assessment or the client's perception of the relief of pain is best a standard of pain relief. The answer is a delta. Next, for the second group of question that is all about electrolytes. 13. The nurse working on the medical unit would most closely assess relative to the risk of dehydration. The client is A, 32-year-old with fracture, B, 47-year-old hyperthyroidism, C, 53-year-old with hyperpulmonary embolism, or D, 78 years old with dementia. Of course, elderly clients are at risk for several age-related decisions. In addition, persons with dementia may not recognize the urge to drink. The answer here is letter D. Number 14. The nurse makes evaluation that the client of one of the adult clients in her care is adequate when she measures the total daily intake as 750, 900, 1000, 2000 ml. This adequate daily fluid intake when an annual is best uh, best to have it on a 1500 ml. So the answer here is letter D. That should be 1500 to 2000 ml. So 14 is letter D. 15. The nurse anticipates that an order for isotonic intravenous IV solution will read 5% dextrose or 9% chloride, 5% dextrose in water, 5% dextrose or 45% sodium chloride. The answer here is Bravo. Next. The nurse assesses a client with urine output and recognizes indicative of a complication. The finding 30 ml of over 2 hours, 50 ml over 2 hours, 300 ml over 8 hours, or 1400 over 24 hours. So the best answer for number 16 is letter B. 16 is next number. The nurse assesses a client's urine output and recognizes indicative of complication. The finding of 30 ml over 2 hours, 50 ml over 90 minutes, 30 ml over 8 hours, or 1400 ml over 24 hours. Of course, an output of 30 ml or less every 2 hours is indicative of a complication. So, but in this case, there's no complication at all. 16 is alpha. 17. When assessing laboratory values for the client diagnosis, the fluid excess, the nurse finds the value that is consistent with diagnosis to be plasma osmolality, BUN of 12, hematocrit of 46, or plasma sodium 129 ml. So with fluid overload, the concentration of solutes is decreased by the excess fluid. Typical findings include plasma osmolality or 2075 milliosmoles per kilogram, sodium less than 135 millicurie per liter, hematocrit less than 45, and BUN less than that 8 milligram per deciliter. 18. A client with severe burn has third spacing. The nurse explains to the client that often it is self-limiting and will begin to mobilize walk in the small intravascular space within. Is it 4 hours, 10 hours, 24 hours, or 48 hours? So once the inflammation stage passes, fluid will mobilize within 48 hours. Answer Delta. The nurse should assess the client on an IV diuretic for indication of which troublesome side effect of medication. That's increase in urine, decrease in potassium, decrease in edema, or decrease in weight. The answer is letter B, decrease in potassium. If there is an increased urine, decrease of edema, and weight are expected outcomes of diuretic therapy. Loss of potassium can cause arrhythmia and seizures. 19. Bravo. 20. A client has a multi-system organ failure, has 20 following electrolytes: sodium of 129, magnesium 26, potassium 5.9. The nurse interprets that this client has hypernatremia, hypermagnesium, hyperkalemia, hypernatremia, hypermagnesemia, and hypokalemia, hyponatremia, hypermagnesemia, and hyperkalemia, or hyponatremia, hypermagnesemia, and hypokalemia. Of course, we know that sodium is 135, 145, potassium is 3.5 to 5, and magnesium is 1.5 to 5, 2.5. The sodium is below, that's hyponatremia. The magnesium is high, that's hypermagnesemia. And the potassium is 5.9, that is hyperkalemia. Answer C. A client is scheduled for surgery. The following day's preoperative electrolyte levels drawn. The nurse would modify the surgeon's office to report serum sodium of 22, calcium 4.8, potassium 3.5, or chloride of 101. The answer here is letter C if there's a problem with potassium because it might result into the possibility of cardiac arrests. A nurse knows that the client has stat order for sodium polyester sulfonate. The nurse quickly checks serum laboratory results, anticipating hyponatremia, hypokalemia, hypernatremia, or hyperkalemia. Of course, opposing young sodium and also potassium. Of course, what we're looking for here is the potassium. So we're talking about hyperkalemia. So 22, the best answer is letter T. 23. The nurse is reviewing client's serum electrolytes notes a phosphorus level of 1.0. The nurse will assess a client for a history of long-term use of acids of morbid obesity, recent thyroidectomy, or chronic respiratory acidosis. The answer here is letter A, because one of the most common causes of hypophosphatemia are considered to be ingestion of antacids, if there is malnutrition, and hyperparathyroidism, as well as respiratory alkalosis. That is letter A, 24. The nurse preparing IV calcium chloride for a client with hypocalcemia should administer the drug in 55% normal saline over 18 gauge cannula, 5% dextrose in 25% normal saline using 22 gauge needle, 5% dextrose in water utilizing 30 ml cannula, or Ringer solution using 20 gauge cannula. The answer here is Charlie, because calcium products should not be given in saline solutions because saline increases calcium loss, and calcium solution should be given in a large vein with a small cannula to encourage rapid dilution and to decrease the threat of phlebitis. Last number. An older adult woman comes to the emergency department with serum calcium level of 3.9. Then the client's history, the nurse recognizes the probable etiology of this finding as presence of urinary infection, cessation with estrogen supplementation 3 years ago, client's residency in a nursing home for last 3 years, or inhalant medication taken for chronic obstructive pulmonary disease. 25, the answer is letter C. So hypocalcemia can be caused by lack of exposure to sunlight and long periods of confinement in the homes or prisons, and disorders that interfere with absorption of vitamin D. So the best answer for number 25 is letter D. So that's it, everyone. Thank you so much for listening.